of IPPA. IPPA has put together a good few webinars. This one is to do with the medical and surgical training interviews and interview preps. I will share links to the other important webinars as well. If you're at this point in career, we have a very esteemed and experienced panel today. They have lots of experience and they will be giving you lots of tips and trips of how to go about this. Just a brief about IPPA. Our aims and objective in IPPA is to highlight the achievements of Irish Pakistani professionals and contribution to society, provide a professional support to the career of the young generation that are coming through Ireland, help integrate Pakistanis into the Irish community, and support the community welfare initiative. There are over 800 members in IPPA. 85% are doctors, but there is IT, accountants, engineers, solicitors, business, and we're broken up into two groups, IPPA Med, IPPA Tech. We also organize events for IPPA Med, IPPA Tech, but also social events where we can mix both groups and have function and keep our Pakistani culture alive in Ireland. These are some of the events that we have recently hosted. Amongst these, you can see there's a large variety. There's been a coffee meeting with IPP Tech. There's been home and internet security webinars, our annual event in 2022. We've had navigating careers. We've had webinars for HPAT. We've even had a Ghazal night, which have all been well received and taken part in the Irish community. So without further delay, I'd like to mention some ground rules. For all the participants, I would really request for yourselves to keep this on mute. You can ask as many questions as you want on the chat box. We'll try to answer as we go along. And at the end of the session, we'll open the floor to questions to the panel. If there's someone specific you want to ask, by all means, you can mention that. Otherwise, it will be answered by the panel in general. We do record these sessions for the future, and so that they could be helpful for other people as well. These are our esteemed speakers, and I would like to thank them well in advance. They've taken time out on their Sunday to be here to present and to explain things to the young trainees. So I'd like to introduce Dr. Khalid Sarwar Khan, who is a consultant orthopedic surgeon and lead clinician in the RCSI group. He's currently at work and has taken time off in his busy theatre list to come here and present. So I'll hand over to him and we'll go from there. Dr. Khan, if I can ask you to unmute.
Thanks, Adil, and thanks everybody for organizing, especially Adil, Zubair, and the team. So I think probably Sunday, most trainees are still relaxing, but I think there are very few who have CST interviews. They might be more interested, and probably we have those. So I'll start the CST or core surgical training briefing. So in this briefing, just to give an overview, Adil has given, but all the speakers will try to cover different aspects, and we got two SPRs and Adil himself. We can just cover different aspects and then the question answer. Adil, can you push the next slide, please?
Yeah.
Okay, so this is a new system, and whatever information we're getting, it might just refine more, but this is the information so far. That this interview panel is comprises of 4 people. So you expect when you go there, it's very important to know what you expect there. So you will be expecting a chair and 2 interviewers. They are the same, like 3 consultants. One will be will be acting as a chair, and the 2 will be interviewers asking questions. There will be a member from the administration of Royal College or surgical training scheme who will be noting, who will not ask any questions. So this is kind of set up. So once you enter, there's a format to this. Next slide, please. And enter means enter in your online system room, because this is all online now, and you have to prepare yourself like you are doing an interview in person. So you dress properly, you sit and check your all equipments, your computer, your camera, your connectivity of the internet, and the voice quality and the light in the room, And unfortunately, I'm at work, so I couldn't have control on those things. But in generally, when you are planning this interview, you should set in the part of the room or workplace where you think is the best all these things present, so you can present yourself better and fully. So the chair will introduce himself and the other panel members, and then will also introduce yourself to the panels. And then he will ask you to do a 2-minute prepared presentation. This is the key of your interview. So this is not on slides. Then you're not supposed to share any screen on that. It's just talking. So it's just, put it this way, it will be a question like we ask in the most interview before. Tell me about yourself, or can you take us through your CV, or what is what are your strong points. So whatever way you can put up the question, but this is a question you really have to prepare well and time it for 2 minutes so that you can showcase everything what you have extraordinary or shining, and what are your strong points to the panel in a way very honestly, not to overboost about anything, not to waste too much time on one point only, and you score and cover at breadth. And I'll, in the next slide, I'll tell you what the kind of content of the interview, so you can try and cover your aspect in that introduction, those 4 aspects. And then after that, the candidates will be questioned on the 4 themes by the 2 interviewers, and roughly around 4 minutes for each theme. This is more like a clinical themes, and they will cover the themes or some other aspects of professional development or other things. And then that will kind of try to assess your competency and suitability. And finally, the chair will then ask if any outstanding issues, or just try to wrap up the things. And overall, the interview on paper say about 18 minutes, but say it's about 20 minutes time. So you should be preparing yourself to have a tense 20 minutes, but I won't say tense. If you prepared well, it will be relaxing and pleasant 20 minutes. It's all preparation. So if you prepare your answer well, if you are anticipating the question and ready to answer, it will be a joy for you that you have shown your ability and you have scored. And there's a copy of guidance for the virtual interviews 2023 has been posted to all the candidates. I'm sure you all have received who are going for CST. Go through it and mark the important points, and then prepare it. It's just like a driving test. So you have to drive as per rule, and then you will pass. So next slide, please. Next slide, Adil, please. Thanks. So that 4 themes will be divided into different, like clinical judgment and decision making. And it's a common scenario. You can understand you're going for surgical specialty interviews, so you expect question related to these. And this is those who are working shouldn't have any problem, but then think in your mind, what are the situation you can come across, or somebody can ask in the surgical specialty, mainly general surgery or other surgical specialty, which are kind of related to each other. So have your answer prepared, and you should be okay to go through this all right. Then interpersonal development, then what have you done, or whatever the other courses you achieved, and what are the other kind of aspects of professionalism you have gathered in the last. It is good, more important for the trainees who are who have done 1 year SHO job or further, interns, because they are doing the internship. For them, it might not be more focused on the courses, but at least they can show they have done some, and they are working on it, and they are planning for some, whatever you can mention in these, that you have booked some courses or exams and things. The same comes in the professional development. As I said, the interns, most of them don't have time, or they are just out of their colleges, so they haven't done the MRCS or other exams. But those who are doing the SHO job, it is important. They might have done some exam. If they haven't done, at least book one exam and mention you are appearing in that exam. That's for the exam point of view. But apart from that, there are some courses in every specialty which give you some more practical experience and more knowledge. So you can also bring these in there. And also you can just mention about some research, what you have done in your units. And even if it's not related direct to surgery, but any research, you can just mention and say, this is the medical research I had done, and now I'm in surgical specialty, and I'm now planning to do this research and audit there. And then general suitability of the specialty. Generally, we want an enthusiastic, active, honest, reliable, and safe doctor. And this surgical specialty need a lot of multi-site trusting. Can we just turn off the mic, please? There's some voice coming in the background. Thank you. So, because surgical specialty, most of the hospitals in Ireland are multi-sites services. So we need more active, enthusiastic, and that's what we're looking for in the doctor, which is reliable, safe, and who's interested in progressing and learning. So I think I'll stop here and I'll give back to Adil, and the rest of the panel can add on these things.
Thank you very much, Dr. Khalid Khan. That's an excellent overview, and it gives you a very good idea of what the interview will encompass. This is online, things have changed, and it is by Dr. As Khalid Khan said, be prepared. If you are prepared, this will be an easy thing. If you're not prepared, it will be a very tense 20 minutes. So make sure you prepare the best you can. Now I'll move on to our next speaker, who is also a consultant general surgeon and medical director in Whitfield Hospital in Watford, Mr. Asim Ishaq. Thank you for unmuting, and we'll ask you to present, give the people tips and trips.
Yeah, thank you very much for the panel and all the organizers. My advice is going to be very much a helicopter overview, because there are many excellent speakers further down from me who have done interviews more in the recent past. So very basic advice is make sure that you have allocated enough time prior to this particular event so that you're in a stable environment, you don't have any Wi-Fi issues, and you're using a simple device. Very, very simply, for the 2-minute presentation that you need to make, for which you don't have slides or notes, ideally what you should do is to write it down somewhere beforehand and do multiple takes on a device, i.e. get somebody to sit in front of you and ask you the mock question, and you basically say those 2 minutes, whichever way you're going to say, few times before, and look yourself again in the video and see what have you said in those 2 minutes. Now, that does not come out like that you have written it down and now you're narrating it again. It has to be coming out naturally, and this is basically going to be a starting point from where the various questions are going to flow. Okay, so more practice you can do, especially after a video review of you, what you've done, it will become quite natural. Moving on further, it's important also that all the facts in the CV and all the things which you have said were correct. If you have mentioned any aspect in your CV for which you do not have the backing documentation or other aspect, it's time for you to make the application, because you are going for a professional interview as a professional person who is a registered medical doctor. So there should be nothing in your CV for which you do not have the backing up experience and the qualification or whatever you have said. As regards to if you have any publications or any research done, you may be asked some questions. It's important that even if you're a author number 2, 3, 4, that you know about what the study was and what was it, what the publication was. Moving on further, then you have, it's a very structured interview. So in terms of interpersonal development, it's important that if you have done anything outside the sphere of medicine, even as a medical student, you were part of any societies, you are doing anything for patient welfare, other organizations, charitable organizations, that you do have some details of that, what you did, because what the interview panel is looking at, they're looking at all are registered doctors, all were good performers, all have done very well in their med school time. They all want to go into a particular program. So actually on the paper, everybody's almost the same. It's the interview which is going to get you to the next level in terms of the rank, in terms of your ability. So go back, look into, see what have you achieved before, and whatever is there, you know, but it has to be backed by facts. It cannot be fiction. Moving on next, then in terms of professional development, obviously your CV speaks for itself, that what kind of courses, etc. you have done. So if you have done something which was nothing to do with clinical life, that's perfectly fine, because in any profession, we appreciate and respect all the non-clinical activities somebody may have done. So if you have done anything in terms of, which is not really the core clinical, but you have the evidence, that you should be able to say a few things about that. Also, it's important that if you're asked what are your future ambitions and plans are, that you need to be very, very clear in terms of what your next 5-year objectives are and the one beyond 5 years. Now, I fully understand that this is not the higher specialty interview. It is for core surgical training, which is very much, so you may not have decided as to what career path you're going to take in terms of a subspecialty training. But again, if you have any aims and ambitions, you can basically describe that, okay, let's say if you want to do core training and then become an orthopedic surgeon or a spinal surgeon or neurosurgeon generally. So you need to have some degree of kind of professional statement as to all of that. And finally, before I move the speakers to come in, which are much, much bigger details, and I look forward to any questions from you all. What's important really is that what an employer is looking for, a person who can communicate freely, who can answer question with great ease, is polite, pleasant, professional all of the time. And even if you are given a difficult question, if you don't have the answers, just apologize and say, I sincerely apologize. I just cannot answer this question. I cannot get my thought process around it, rather than trying to answer a question and getting into more and more difficulty. So it's what basically the whole process of interview. Your CV has got you into the interview. In interview, most candidates are going to be almost kind of same with very little differences. So it's going to be your performance by answering certain questions, which is going to get you the actual marking and the listing and whatever the gradation is going to be on that. And also remember the two things which I can give you, the take messages, no matter what the outcome of this is. These things be, if you want to train as a doctor, so FAIL stands for fail. No, it's first attempt in learning. And NO means next opportunity. And END means effort never dies. Thank you.
Thank you very much, Mr. Asim. That was an excellent quote at the end, but also a very good overview of what an employer is looking for. So please keep that in mind. They are looking for what, as Dr. Asim said, someone that can communicate and someone that they can work for. Our next speaker is Dr. Rosie Offey. She's a senior lecturer and director of curriculum of RCSI. She's also the clinical lead of the intern program. Thank you very much for taking time out to speak to us on this panel. I'll hand it over to you yourself.
Great, thank you so much. Good morning, everyone, and I'm totally honored to be invited to speak today at this event. I totally agree with my colleagues that have gone ahead. I think there's definitely pockets of wisdom there that you could all take. And I think when you're preparing for an interview, one of the greatest things is to gather all the information you can and filter it to suit it for yourself. In the next 5 to 10 minutes, and I promise I won't take more than 10 minutes, what I want to do is really focus on 5 areas. I'm going to start off with some general comments and tips around interviews. Then I would like to speak about the 2-minute presentation that you have to give. And then I'm going to speak about the 3 elements in your interview: the interpersonal skills, the professional development piece, and the suitability piece. These make up 55% of your scores in your interviews. I agree with Dr. Khan and Dr. Istak. If you do not prepare for this, you will fail. So preparation is key, and I can't emphasize that enough. So let's start off with some general rules. I think one of the first things is about being confident. You need to be confident and you need to own this. You need to act yourself into confidence. And that's really, really key if you're going for any of these interviews. You've been invited to interview because you have made it. So you need to be confident. And I think a lot of the time, we all struggle with the imposter syndrome, right? We kind of go, oh, am I good enough? Am I not good enough? Should I or should I not? You've been invited to interview. So yes, you are good enough. So if you're there, prove it. Prove them right for having picked you for the interview. So that's the very first thing. Act yourself into confidence. And believe me, confidence isn't contagious, it's infectious. If you stand there confidently and say what you have to say, your interviewers will be looking, going, wow, I want that person on my team. They're good. So that's the first thing you need to do. There's a TED talk called Amy Cuddy. She gives a TED talk on confidence and owning this and authority and how you present yourself. If you have time, I definitely recommend that you guys have a look at that. The other tip is around body language. You're being observed, even though this is virtual, act like you're there in person. Dress well. Your nonverbal communication is really, really key. Don't sit at the interview and slouch back and, completely not caring. Sit up, look alert, look confident, be yourself. And I think that's really key because you can actually see that through a video. You can see if I'm just relaxing here on the chair versus I'm sitting up, I'm excited, I want to be here. So it's really, really key that body language is really, that you actually be attentive to your body language. Dress appropriately. So men in suits, women in formal wear. Don't assume because this is online, I don't dress properly. Dress like you would dress if you're going out of your house in a very formal way. So I think those are probably things that people know. So I'll leave it at that. So I'm going to move on now and talk about the 2-minute interview. And this is really key. And I think as the speakers ahead of me have said, this is your opportunity to sell yourself. Everybody is the same. Dr. Assam just said that there. They've all graduated from medical school, right? They all have an internship. They've probably all done an SHO job. So they're all the same. The question is, what differentiates you from everybody else? So you get to an interview and they say, please introduce yourself. What's your 2-minute presentation? I'm going to tell you this. Do not say this. So I graduated in 2000 and then I did an intern year. And then after my intern year, I did an SHO year. And then I worked in general surgery. Then I worked in orthopedics and then I worked in vascular. Everybody's done that. What's exciting about that? So you need to pick the sentence that would make them go, oh, I would like to hear more about you. So if somebody was to ask me this, one of the things I could say is, thank you for the opportunity to be here. I have a very diverse background. I was born in Ireland to parents of an African heritage. When I was a teenager, I experienced my grandfather being very unwell. That led me to a joy of studying medicine. After I graduated from medicine, I carried out my internship. And while I was doing that, one of the rotations I did was a skilled rotation in orthopedics. Now I have an interest in orthopedics and I want to pursue this further. That's a different way of actually saying exactly the same thing. I graduated, I did internship, I did SHO, I did all of that. But from that, they could see, oh, you've got a diverse background. We have a diverse country, we want diversity, right? They can see that you're open about your different identities that you want to sell and you want to showcase. They can see that your interest in medicine has spanned since you were a teenager. If you want to add to that, you can add, when I was a teenager, I was the captain of my team. And in being organized, I saw how injuries were managed in the hospital and whatever it is. So try and pick something in your past life that has really enticed you into coming into medicine, because that's the exciting thing that will make you different from everybody else. And I could tell you, I say 80% of people that would go to that interview would say the same thing. I graduated in 2000, then I did an intern year, then I did an SHO. Yeah. So if you just put yourself in the shoes of the examiner, of the interviewers, they've seen 60 people so far. They've all said the same thing. Can you imagine if you come out with that statement that really wows them? And as the other speakers have said, that would be the basis of your interview, because that would really sell them. It's 2 minutes. You need to practice it. If you don't practice it, you will lose it. I agree with the whole stand in front of a mirror, say it, record yourself. A lot of the times what we think in our head is not really what comes out. So make sure you record it and play back to yourself. Does this sound good to you? So for your 2-minute talk, make it snappy, make it interesting, make it sparkle and shine. What is it about you? How do you sell yourself? What is it? This is your opportunity to really showcase yourself. What is it that you want to bring forward? And think about the rule of 3s. Everything is in 3s. So I did this, and I did that. It's always in 3s. Don't do more than 3. 3, and then really big bang of what you want to say. Moving on then to the interpersonal skill topic, which is 15% of your score. It talks about communication, leadership, teamwork, crisis management, and conflict resolution. The one thing I'll say around leadership and management is that, once again, everybody will say the same thing. Usually around management, they go, yeah, I was in the hospital committee, and then I was the NCHD lead, and I did the rota for my team. Everybody does that. So how about something completely different? Management is about getting stuff done. It's getting stuff done through people. So what are the things you've encouraged other people to do? That's management. It's people management. Have you managed a crisis in your team where you had to get all the team together and you got an outcome out of that? That's management. And those are the things that you want to put in place. What are the plans? How did you organize the team? How did you control it? And yes, it could well be, you know, there was a challenge in our team. We weren't really getting in whatever it is. And we decided to change the rota, the way we work. That's management. But there's just don't put it, oh, I do rotas. Everybody does rotas, right? What's special about that? Okay. So it's how you sell it and how you pitch it. And that's why you need to write it down, prepare it, and really focus on it over and over. Leadership is the ability to provide people with a vision. Leadership is about vision. It's about excellence. So what are the things that you have done that has brought excellence in your team? So we carried out an audit because we saw that there was challenges in whatever it is. We've carried out an audit, and that has made a change in the way we work, a change in the way we practice. That is showing leadership because it is future focused and it is showing how you could progress that. So once again, practicing that, I think, is really, really key. Conflict, make sure you have an example of a conflict that you've managed and be able to talk through that. With the professional development pillar, it talks about research, audits, teaching, and all of that. Please make sure you have examples. Like, once again, teaching, everybody does bedside teaching. But what have you done above and beyond that would make you exceptional to everybody else? Have you used simulation? Are they simulators that you've used, that you've actually engaged in? What are the hands-on teaching you've done? Have you been involved in a curriculum? Any innovative things that you've done? Especially with the pandemic, there's been a lot of innovative things we've done to add to teaching. What are those? So those are the things that makes the difference and the things that you really want to focus on. Dr. Khan spoke earlier about research. Pick the 3 main things that make you stand out, your 3 main research, your 3 main audits that make you stand out, and talk about them. Discuss them in detail. So I carried out this research during the pandemic because I noticed XYZ. The output of that has been this. We've been able to generalize that to other teams in the hospital, whatever it is. But make sure you really have read it, understood it, and speak to it in detail. And then finally, the suitability to surgery is really key one. And with this one, I give you 3 things that you need to think about. The first is, can you do the job? The second is, will you do the job? And the third is, will you fit in? And that's back to what Dr. Assam was talking about. First, can you do the job? So yes, I have the competencies and skills to be able to do this. I have a really good track record. I have experiences and qualification to actually show that I am the right person to do the job. I'm interested in this post because whatever, whatever, whatever. What do you bring to the party? What do you have over other candidates? Why should we select you more over other candidates? So what is the competencies and skills you have that makes you stand out over others? Will you do the job? It's about your personal disposition, your energy, your approach, your commitment, teamwork, motivation. Yes, I will do the job because I'm a hardworking, motivated person, and I actually would like to see changes, blah, 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 blah. So what are the achievements you've had that will actually show that you will do the job? And the third rule, as I mentioned, is will you fit in? Everybody wants somebody that would fit in. They want to work with people that fit into the system. So what is your biggest contribution? What are the things that make you fit into the job? I will fit in because I have this and this, and this is how I work, or whatever it is. So it's really about focusing your interview and practicing it and preparing it, writing it down. The last thing I'll finish on is usually the last question that people ask. They tend to ask, oh, so do you have a question for us? And usually when people say that, I would always say, don't say, yes, I have a question. How much will you pay or whatever? Don't go there. I think if they ask you, do you have a question? What I advise people is to say, I don't have a question, but I'd like to leave you with this impression. I can do the job because I've shown over the last 20 minutes that I am the right person with the right skills and competencies to do this job. I have the personal disposition to do surgery because of X, Y, Z. And I will fit into the organization because I have shown that and have a track record to show that I would do that, and leave it at that. And that's the end of your interview. So once again, I think the biggest tip I have for you is preparation. Preparation is really key. So thank you.
Thank you very much, Dr. Gozi. That was an excellent talk and very well giving a perception of the overview and what's needed from an interview panel, from the interviewer, and what you expect. I agree with you 100%. And as the other panelists said, this is practice, practice, practice. And that's the only way you're going to come over that imposter syndrome that you said and feel better about it, giving this interview. Thank you very, very much for your time. Before we move on to Ben Murray, I just want to highlight as well that IPPA has done 2 other sessions in interviews. One is to communication skills in medicine, and one is on CV writing and interviews. I would highly recommend that whoever's on the participants review these, as they are also very useful. And if they have the time, I think this would be excellent for them. I will move on to Mr. Ben Murray. I'd ask you to unmute yourself. He's an SPR in orthopedics. He's taken time out on his Sunday where he's not on call to do this talk with us. So thank you very much. I believe you wanted to share your screen, so I'll stop sharing here. Thank you.
Great. Thanks very much, Adil. Can everyone see my screen there?
Yeah, yes, I can see your screen.
Thanks, Adil. Thanks, everyone. And just want to say thanks to Mr. Khan and the IPPA for having me here today. As Adil said, my name is Ben Murphy, and I'm an orthopedic SPR in Our Lady of Lourdes Hospital, Drogheda. I just want to give you some background. So when I sat the CST interview, it was in 2020, and this was before it was all online. So it was face-to-face, 2 consultants at each table and 4 tables. Now I can see that the stations have remained the same. So clinical judgment, interpersonal skills, professional development, and suitability for surgery. So hopefully I'll be able to give you some tips and tricks from my experience. I suppose the minimum requirements this year and every year indeed are that you would have a medical degree, that you would have completed a suitable intern year, and that your English would be to an appropriate standard. The RCSI have said that there will be 80 spots available for candidates, and that you have to meet a desirable standard before you can be appointed to the surgical training scheme. So If we look here at the first two sections on the scoring system, we can see that the first two, undergraduate academic record and your surgical aptitude tests, they are already scored. So we want to focus now on what you can change and the scores that you can impact. So your undergraduate academic record is based on your centile score in medical school, and then your surgical aptitude tests are the online tests that you take. I seem to remember a spinning arrow that you had to align in a certain orientation. There are a number of other ones as well, but it's been a while now since I did them. So then moving on to the other sections, the ones that you can focus on and the ones that you can influence now at this stage. So clinical judgment makes up 15%. This comprises structured clinical scenarios. I got 2 in my interview. So I was shown a clinical image of an open fracture, which was useful given my career direction now, that I could then talk about it, the management of it. And then there is also a child with a lump in the groin. So differential diagnosis, management plans. As one of the speakers said earlier on, these clinical scenarios are fairly straightforward. And if you have spent good time on the wards and in theatre and in outpatient clinics, you should do well in these. Then interpersonal skills, communication, teamwork, leadership, crisis management, negotiation, and conflict resolution. So my advice for this section would be that you starting now and even looking ahead to hopefully your HST interviews, that you develop a bank of stories that you have to draw on, so that you have an example of leadership, you have an example of dealing with conflict in the workplace, an example of good management that you showed at work, and then use these in the interview. You should always be able to, if they ask you, what do you understand by clinical leadership, to define it, use a personal example, and then talk about how you're going to use your leadership skills in the future. You want to show the interviewer that you're thinking ahead, that you feel you're good enough to get this interview, that you will be on the CST, and that you are going to be a good clinical leader in the future. I'll touch on that later on, but just that's a good framework for answering most questions. And it just takes you start to take control of the interview rather than the interview taking control of you. Professional development. So this is essentially your CV station. So this is your time to shine. At this stage, your CV is, you're not going to add much in a week. So it's time to focus on whatever strengths you have on your CV. Certain people may be applying straight from internship. Some people may have done a year of SHO. So CVs will differ, but I think in my experience, interviewers seem to take that into account, the level of training that you have and what could reasonably be expected from you at that stage. So in terms of research, I didn't necessarily have any publications when I interviewed, but that wasn't held against me because I was still involved in a number of projects, and they could see that I was taking positive steps towards getting publications, that I presenting at meetings, and I had attended a number of courses. Audits, make sure that an audit is not complete unless you close the audit loop. So unless you've actually re-audited. So we had a meeting in Drogheda Hospital recently on audits, and the key take-home message was that an audit is useless without actually closing the audit loop and re-auditing and seeing, have you made a difference to clinical practice. Teaching activities then, as Dr. Ofaya mentioned, everyone does some form of teaching in an informal fashion on the wards or in clinics. But you have to, if you have some specific example where maybe you led a small tutorial group or something like that, that'll make you stand out. That's the whole point of the interview, is that you're trying to stand out from the other candidates and show why you're the most suitable person for the job. Then this station's suitability for specialty training. As you can see, it's more heavily weighted than the other stations, so it's worth 25%. And this is essentially the meat of the interview, and it demonstrates to the interviewers why you want to be a surgeon. Thinking about questions that I got when I was in this station. Why do you want to do surgery? Where do you see yourself in 10 years' time? They want to see that you have a clear career path and a clear focus for your future career, and that you're thinking even beyond you're thinking even beyond this interview and thinking about HST and thinking about SPR, that you're fully committed to surgery, because it is a big commitment, but it's a very fulfilling career. But they want to see that you have a plan and you have a clear focus. Just looking at other questions here, I just made a note of last night. If, questions like, if you are not selected for the surgical training scheme, what are you going to do? And so this is, again, a test of your commitment to the specialty of surgery and this career in general. And they may ask you, have you applied anywhere else? And I think, in fact, they did ask me, had I applied to the UK or to Europe? And I said that I hadn't, because on my own, I felt that this would dilute my focus in terms of applying for the surgical training scheme in Ireland, and that this was the only training scheme that I wanted to be a part of. Another question I got in this section was, do you agree with doctors going on strike? Which I suppose is, a relevant topic at the moment, and there have been, the NCHD population have voted that they would take industrial action. But at the time when I was asked this question, I said that this wouldn't be something that I would agree with, because I feel that in a hospital setting, when everybody else takes a step back from the patient and says, that's not my job, I'm not trained to do that, that's not for me, I'm not doing that, I'm on my break, X, Y, and Z. Ultimately, the doctor is responsible for the patient, and we are the last, I suppose, we're the last people that patients have. And if we give up on patients, then I don't think that would be a very good thing. I mentioned 10-year plan then as well. So there, look, that's the scoring system for the interview. These are the 4 stations that you need to focus on. Focus your efforts. The first 2 have already been pre-scored. Other things, as Dr. Ofaya mentioned, this is your chance to sell yourself and to ensure that you make a good accounting for yourself, that you put your best self forward, that you only have a short window of time. It's not, most of us don't like talking about ourselves or talking up, or, kind of saying nice things about ourselves too frequently, or coming across as arrogant. There is a fine line, obviously, but the interviewers want to see that you're confident and competent, and that this is something that you really want. As Dr. Ofaya was saying, body language makes a huge difference. Sitting up straight, the non-verbal communication. Even though this interview is online, wear the outfit that you would wear to the interview. Were you going into RCSI to do this interview? I think that's very important, because it gets you into the mindset that this is how I'm going to present myself, and the interviewers will take you more seriously then as well. But even from your own point of view, you will feel better and you will feel more confident on the day. As I mentioned earlier, a proactive framework for tackling any question really, and really taking control of the interview. The interviewers will throw you out a question, but it's up to you how you answer it and how you frame your answer. This is your chance to say what you want to say, provided you answer the question. So it is important not to go off on a tangent. But something like, as I said earlier, what is clinical leadership? Don't just, as Dr. Ofaya was saying, don't just say the same thing that all the other candidates are going to say. Take it that step further. So they ask you to define it, but then give a personal example. You need to tell them what you did, what you've done before, and then talk about the future and how you're going to, how you might use clinical leadership when you are a surgical trainee on the core surgical training scheme. So put that energy out there, that without being too arrogant or overconfident, that you're going to be on this training scheme and you are going to be a useful trainee and a worthwhile colleague as well. Mr. Khan mentioned earlier in his talk about patient safety. So this is obviously paramount, and it comes into every question really, and it should be at the forefront of your mind when asked any question. For example, a common one that comes up, a difficult colleague, or even a colleague that comes in drunk or not fit to work. There is a framework for these types of questions, which I'll touch on later on, but your main concern in these scenarios is not necessarily the colleague, it's always the patient. So if you show them, you know, it won't, not that it doesn't matter what you say after that, but if you say, I would, you know, I would ensure that this colleague is removed from the clinical arena, that they can no longer see patients, and the patient safety is maintained, you know, the interviewers are going to be very happy with that. And then what you say after that is just bonus. So keep that in mind. Patient safety is key. Some people get a little bit afraid of the so-called negative questions. So things like, what is your main weakness? So I was told before when I was preparing, this is more for the HST interview, but it obviously applies here as well. What is your main weakness? So you can turn that into, you can turn this into what you want it to be. So you can change weakness into a development need. So, you know, for instance, I said, well, at ST2 level, I haven't completed many hemiarthroplasties. So that's my development need. But I've made a plan with senior registrars to attend trauma lists at the weekend to perform more hemiarthroplasties, so that then when I start on the specialist training scheme, I'd have, you know, worked on this development need. So, you know, you can turn what sounds like a very negative question and a chance to catch you out into something proactive and into something that you're going to work on and that you've already taken active steps to work on. Because, you know, surgical training is difficult and it is challenging, and everyone has something that they, you know, would find difficult. But it's how you get around it and how you're taking the initiative to work on it, and how you're taking the initiative to improve yourself. Another so-called negative question then is, tell me about a mistake you made at work. Again, I think interviewees might think, you know, the interviewer is trying to catch me out on this. They're trying to see what's the worst thing I've ever done at work. Now, there is obviously a fine line here. If you're going to, when you're telling about a mistake that you made, you have to think about it as an opportunity to talk about open disclosure, and then risk management. So you turn the question to your advantage. Tell me about a mistake you made. It's how you know, if it's something that is highly dangerous, it's probably not something that you should bring up in an interview. But if it's something that was a minor issue that led to, a near miss or something like that, something that you've learned from and that you've actually actioned and you've taken positive steps to ensure that it doesn't happen again. So, you know, you can turn it around, but again, just to be careful and make sure that it's something that's not too serious that would make you seem incompetent or dangerous. Again, Mr. Khan was talking about this in his talk. I suppose technical aspects to the interview to do with doing it online and doing it on Zoom. General things like having a blank background that are not going to distract from you and your your overall presentation during the interview. Try and have your camera at eye level, so that you're replicating what would happen in real life if you were sitting into you in person, that you're making good eye contact. As Dr. Afai was saying, good non-verbal communication at all times. You're a strong, confident personality, and you're able to maintain that eye contact during the interview, albeit online. I mentioned earlier about wearing the outfit that you would wear to the interview itself if you're going into RCSI. Make sure it's a quiet environment, and also a trial run would be no harm. Most of us say, "Oh, look, it'll be grand on the day. The answers will come to me when I'm actually sitting there in the interview." But it's completely different in the actual interview versus practicing at home with your friend, your colleague, a family member. Practice speaking, practice your answers. This is something that you can improve on. And the more you speak, the more natural it's going to sound on the day as well. Anyway, as I was saying earlier, there's some structures for certain types of questions. So you may have heard some of these before, but for background and motivation questions. So, tell me about your CV seems like a very open-ended question, but you can and you need to structure your answers in such a way that you get the relevant information out, and you don't ramble. Your answers shouldn't really go beyond 1.5 to 2 minutes, because human nature being what it is, people will lose interest. You need to structure your answers in a certain way. So for background and motivation, you can use the CAMP structure, which is clinical, academic, management, and personal. Then for that other scenario that I mentioned earlier on, for instance, the difficult colleague or the drunk colleague, you can use the SPIES acronym, which is seek information, patient safety, initiative, escalate, and then support the person in need. I'm just going to show you a resource in a minute or two, and actually this resource has all these frameworks in it. As I said, a book of stories for every situation that you can then draw on. And you look, these are going to be personal to you, and that's the whole idea, that you can then you seem more interesting, that you haven't just taken these directly from an interview prep book. So build up this bank of stories, and you can use them interchangeably for different scenarios, leadership, frame, teamwork, conflict in the workplace. Just you can make them work for you. Finally, then, just that resource I was going to show you. Don't know, can you see that on your screen? This book, Medical Interviews, I didn't buy it for the CST interview, and I wish that I had, because I used it for the higher specialist training scheme interview, and it's fantastic. And I think it's probably worth everyone taking a look at least once. It's more in line with the UK interview process, but a lot of the same questions are repeated, and you will see similar themes in both. So definitely worth a read, even at this stage, to get a PDF of it and to take a look through it. It's good for structuring your answers, and you can obviously take what they have and apply them to your own experiences. So that's all I have to say about the CST interview. I wish you all the best of luck, and obviously if you have any questions at any stage, if you want to pop them in the chat, or I can even put my email address here, and I'm more than happy to speak to anyone at any stage. And again, thanks very much to Mr. Khan and the IPPA for having me.
Thank you very, very much, Ben. That was very, very helpful. Gives a very good perspective on how you should take the interview and how to prepare for it. And like everyone has been forcing, preparation is the key for this. I'll just share the screen again, sorry. So we have one final speaker before I invite Mr. Canal to come and speak, who is also an SPR in orthopedics. I just would like to remind that there are links and things that you can do to help practicing, and these are the few links. I've also put them in the chat. Our esteemed panel has also put suggestions and the structures in the chat, so it would be well worth looking at that. So I'd like to ask Mr. Canal if he could unmute himself, and I'll hand over to you for the last and talk. Thank you very much.
Good morning, everyone. Thank you to Mr. Khan and the IPPA for having me today. Thank you to all the speakers and the faculty for what were really excellent and very insightful talks about the interview process through, I think, CST, and also going on further to HST. So these are very valuable lessons. It's important to take a note of a lot of the pearls that have been given so far. I think really ultimately a lot of the main points that I would touch on have really been covered very well by the faculty so far. I'm just going to reiterate some of them, which I think are very important. The first thing that I think is vital, and again, it's been touched on a number of times, is it's important to take this virtual interview as you are sitting in front of your panelists. So dress, body language, your picture, the light, your speaker, clarity, all these things are vital. And I think it's important to make a very good first impression. Being sloppy in terms of your presentation, your dress, I think just gets you off on the wrong foot. The second thing that I think is very important through both my experience with the CST interview and going on again to HSC interviews, it's vital to have an understanding of how the scheme works. So if you're applying for surgical training in RCSI, you need to know how it works. So you need to know what competencies you need to achieve throughout your core surgical training, how the structure of your jobs work, how you then apply into HST, how the HST works, at what points you need to do your exams, etc. It's important to show that you've taken an interest to find out why you want to apply specifically to the college. to do surgery here rather than a generic, I want to do surgery because I like operating. I think that's very important. In terms of your preparation, if you look at some of the questions and you think about them superficially, they do seem a little bit vague. Tell me about yourself, etc. And there can be a tendency to almost want to wing these a little bit at the time. It's important to prepare for this interview like an exam. So you need to really have a structured approach, have, as Ben alluded to, have set examples and set answers for a lot of these questions, points you want to touch on from your CV and your experience in replying to these questions. And similarly, what I do want to emphasize is that you really do need to sell yourself in this interview. So as Dr. Afia mentioned, you can have a very generic answer for I've worked here, I worked there, and as she alluded to, that's pretty common for everybody. So you need to take this opportunity to sell what you think are good aspects of your experience, of your qualities, of your personality. And it's important to try and get these across during the interview. Again, it's difficult. And as Ben alluded to, there is a fine line between wanting to blow your own horn too much, but at the same time, they do want to see people that are confident in their own experiences and in their own abilities. And as alluded to earlier, the fact that you've been accepted to interview for the scheme means that they feel that on paper you do have qualities which are potentially suitable for surgical training. So it's important that you have the belief in yourself to get these across, okay? Very important to have an understanding of general definitions, and there are HSE documents in regards leadership, the audit cycle, management, risk, and it's important to have a generic 1 line to 2 lines on these. But when answering these definition questions, it's important to bring in your own experiences. So you can say, for example, they'll ask you, what is leadership? You can give your quick sentence or 2 sentences in a definition, and then more importantly, go on to discuss your own experiences of leadership. And you can say, I've been fortunate to have had lots of leadership experience or exposure to leadership scenarios throughout my career so far in regards X, Y, Z. And then you've evolved your answer from what somebody can read in the book to your own experiences. The one other thing I would say, just as a general tip on the interview, is that it's a CST interview. So when you're applying for the scheme, you may know you want to be a general surgeon or an orthopedic surgeon, etc. I think it is important to get across your general enthusiasm for surgery as a specialty. They'll be able to see quite clearly from your experiences, your audits, your research, which specialty you may or may not favor. But what I would be careful of is pigeonholing yourself into saying, I want to do orthopedics, and that it is important to be aware that your panelists will be a variety of surgeons from different specialties, and they're really looking to assess your general enthusiasm for surgery as a whole. So I would just be a cautionary note on that. What I'd like to do, I think, would be useful, and again, I'm cognizant of the fact that when I'm sitting on the other side as a participant, these are always quite difficult, is I'd like the candidates to pop their cameras on. I might do 1 or 2 mock scenarios, and what I would allude to is a message I put up there on the chat, which Ben mentioned earlier, which is it's important to have a structure to your questions. And these structures are vital when you get asked a question that you're not expecting. If you're thinking in a structured manner, you can draw bits and pieces from other answers that you may have thought of, and you can put together quite a sensible answer when they try and catch you in the hop. And they might try and catch you on the hop just to see how you deal with something that's a little bit off-piste. So can the candidates pop on their cameras, please?
Can one of the person, any candidate there?
Abdul or Dara?
Okay. Dara or Omar or Hamdoun or Imran.
Usman's also there.
Usman
And
there as well. And Yusra Siddiqui, I think she's also candidate for Zaim Awan is there. So any one of you guys, this is for you. So one of you should come up. No matter you're still in the bed, just open up the camera and ask.
Again, I'm cognizant of putting people on the spot as currently ongoing as a trainee, but it's important to practice. I think particularly in the online format, it's important to practice answering these questions through Zoom. because it is a little bit less natural than what you would be used to doing normally. Grant, so what we'll do is, who we're going to pick? Usman, can you tell me about yourself? Why do you want to do surgery?
Usman, you're mute. You're still mute there, sorry.
Can somebody mute
Hear me
Usman?
now? You can hear me now, yeah?
Yeah, can you hear us? How are you going?
Okay. So I've always been interested in surgery since medical school. I've noticed they've always made a difference, and even in my work, from admitting to operating to discharging, patients always have a good outcome, and I feel they feel we make a difference. So just want to make a difference.
Okay, so what I would recommend, I think you started well, and it's important, if you think back to what Dr. Offia alluded to, it's important to have a well-set spiel that kind of covers the various aspects of why you want to do surgery. And Ben alluded to the CAMP structure, which I put up in the chat group there. So you focus on an aspect of clinical, which I think you did, to focus on some of your academic backgrounds, so your management or audit experience, and then some of the personal aspects of this. And you think about things in a structured, headed manner, and you try and touch something on each of these points. I think you'll have a structured answer, which gets across your enthusiasm. And it's important to show that you've been enthusiastic to do surgery by the things you've done so far. So it's very easy to say, oh, I love surgery, I love operating, I love, working in a team, blah, blah, blah. But you need to have some concrete examples of what you've done so far to back up these statements. Otherwise, they can be a little bit vacuous, So do you want to have just a general go? It doesn't need to be a detailed answer, but just some of the headings you might want to touch on in your answer.
Yeah, I'm not too sure. I'll have to make the structure,
Yeah. But I think, and again, it's not specific. It's really for everyone. It's important, even when we were, as Ben alluded to, and I was a couple years ahead of Ben. But it's important, even coming through HSC interviews, is just to have a structured approach to answering questions when you get asked something that you're not expecting. But well done. That's very good. Now, next, who can we ask? Imran, how are you?
Hello, how are you doing, sir?
How's it going?
Good.
Tell
Not too
me,
bad. Good.
what's your experience of teaching in surgery? And tell me about the teaching you've done.
So, as I've been a registrar in the hospital, and since my career, I have been involved in a lot of teaching sessions. So, if I will tell you that because on this basis, I have been given the opportunity to do some bedside teaching when I was when I was back home, and in this way, we used to teach the medical students and as well as the internees who were supposed to be rotated in the ward. So we used to teach them the bedside techniques, the bedside sessions, and also a lot about the clinical stuff. So then, as we move on, obviously, we were given the chance to teach also the medical students which have been rotated from the Galway University Hospital, and they have been when they were going to be sent here for a rotation in, for instance, once they say they will be rotated for orthopedics, and they have a rotation of 4 weeks. So in that 4 weeks time, we will be given a curriculum on which we will be given the topic. So for instance, I was given the topic for the spine, and from the detailed examination along with the differentials, I was being allocated 12 students, and as far as I was concerned, I got the feedback that they were all the 12 students. They were very happy with my teaching, and I love to excel myself in the teaching in this field. And obviously, as a part of management, I would love to do some courses in order to get myself excel in this teaching in this field. And from personally, I have done I have attended some courses also in order to get myself advanced in this profession. As I see that in the future, I would like to see myself as a supervisor teaching the medical students, and this is one of my aspects which I want to flourish more as a part of my profession.
Excellent, very good. So I think that was a very good answer. So what you did, which was important, is you alluded to a specific example of your experience, which again shows that you've taken the initiative to do something. And what you did very well is you reflected very well on the activity, or your experience so far. You alluded to things you've done to improve yourself in a teaching aspect, you know, courses, etc. So I think you did very well there. There's a structure, another structure that I put up on the chat, which is a star structure for questions, requesting an example. I think you use that quite well.
Yeah, I use that. Yeah.
Situation, task, the action, and then your results and your reflection. I think it shows that you've thought about it and you've actually sat down and thought about things before coming to the interview. So that was excellent. What I would say is try and keep it relatively short and directed in your answer. And what I would also say is just be very specific in, say, I did bedside tutorial teaching in this, say a specific, just to kind of make it specifics rather than sounding a little bit more vague. That was excellent.
Thank you, Dr. Kunal. Doctor, can I ask you one question?
Of course.
Yeah. Dr. Kunal, I was just confused regarding the clinical scenario, that how far they are expecting from us to go. Like one of my colleagues, they just told me that he was being thrown a question of regarding a prostate cancer. And they went into the management also, but like so far. So do we have to go in such a depth that to just get ourselves oriented with what's the management, what the current treatment plans or the current options?
Yeah, so I think that's a good question, because I remember thinking much the same coming up to the interviews, and I think Ben alluded to it in his talk. Is really, for the most part, my experience of it is it's quite generic surgical emergencies, for example, upper GI bleed, an open fracture, etc. And I think if you're doing well, they might push you a little bit more on some of the management strategies, but I would really focus on your broad strokes and your basics. I think, again, it's important to think about, for example, in the orthopedic scenario, just being very systematic in your approach, ATLS principles, primary assessment, secondary assessment. And what they really want to see is you're a safe doctor. And it comes back to this station is purely a station in safety. This isn't the station to start talking about all the femoral nails that you've done or all the lap choles that you've done. This is a station just to say, I'm safe, I'm competent, and move on and shine in the other stations, you know?
Perfect.
I'll just come up here for a second. You were mentioning that your colleague was asked about some carcinoma, is it, and how you manage it?
Yes, boss.
Okay, so I think here what most of the time we as seniors, we are looking for a safe doctor. So it's not that everybody know it's the oncology job, the treatment, but we know what steps you will take to make sure you diagnose or help in diagnosis, refer to the appropriate specialty soon as possible, and then they can plan. So you should know what initial bloods, what investigation, which team to involve, and where to refer. That's the one that we want in few sentences, and we know you are safe doctor.
Okay.
And I think that was my experience as well. Even coming into a SBR interview, is it's really just to be safe and get that across quickly.
Get that across quickly.
So that was a very good answer. So well done.
Thank you, Dr.
One or two more questions. Again, and it's all practice. This is all practice, so it's a good opportunity to think about things. And
is there Hamdoon, Omar, or somebody else there ready to take a question?
I was going to ask Dara if he's on.
Yeah, can you hear me?
Hi, mate. Dara, tell me, do you think research is important in surgery?
I think that research is important in surgery. The basis of our care should be evidence-based. We shouldn't be using treatments for which we don't have a good reason to offer them to our patients. My own experience of research, both in the development of new techniques, which I did before I came to medical school, and research as opposed to audit, which is comparing our current practice with best practices, versus the research aspect, which is trying to develop a good evidence base. I found this beneficial to my training and my own personal development, my understanding of what we do and why we do it for patients. In terms of developing new technologies and new treatments. Before I came to medical school, I worked on some spinal surgeries, trying to develop new techniques. And I found that very stimulating and interesting, being at the cutting edge of surgical progress. In terms of the more recent work, on a more ground level, we looked at whether or not our surgical trainees were better with more experience at recording data in a national registry. Working with a team in that sort of situation with my surgical colleagues and making a small contribution to the knowledge. Of course, we're contributing to surgical knowledge overall, but I think the real benefit from a trainee's perspective is engaging with the process so that you have a better understanding of how we develop safe, helpful medicine for our patients.
Excellent. Yeah, I think that was a great answer there. I think you did exactly what you need to do. Is it's very easy in this and that question to just be very vague about research in surgery. I think what you need to do in these types of questions is exactly what you did, is allude to your own personal experiences. I think the fact that you touched on specific examples, both, as I said, prior to medicine and during your time to date is very interesting. I think my experience of the interview is that the interviewers then will sit up and say, that's interesting. Now I'm going to ask them specifically about this. And you get talking about specific things which make you stand out versus the generic candidate who just says research is important because we have to do research in surgery. So that's really good, I think, in my opinion. So two more I want to ask. So who would I ask next? Hamdoon, are you on?
Yeah, I am. Hi.
Hamdoon, how are you? How are things?
Good.
Hamdoon, tell me, what attracts you to pursuing surgical training in the RCSI?
So, I mean, I have a very diverse background in the sense that both my parents are Irish trained, and I moved back to Pakistan when I was really young, when I was 10 years old. So I've moved back now after maybe 15 years. And the first thing that caught me is the sort of the way the training goes about, where it's very structured. And, you know, you rotate in a specific department initially of your choosing or what you get, and then you do a few good time in general surgery as well. So you're not just a doctor who does a specific niche, you're a doctor who does general surgery and understands things on a general surgical perspective as well. And I feel like with such a structure and with such teaching, I believe my career in surgery would progress very much. And I believe I can understand lots of things as compared to someone who's not on the scheme.
Absolutely. Yes, I think that's a good structure to an answer. I think it's important. What I did coming up to the CST interviews, I actually went and looked at the HST document, as in how the scheme works. So I had an idea of, you know, what the types of assessments you have, how many years, how you rotate, when you do the FRCS, etc. And I think your answer, the bones of your answer is very good. I think what you should try and do is try and allude to very specific examples of, for example, as you said, you work in different teams. So you can say on the CST, you know, you work 6 months in one job, the second 6 months in a different specialty. So you get a wide exposure to different surgical specialties before narrowing down to your own choice. You can talk about, say, the HST, and it is appropriate, I think, to a certain extent to discuss, for example, the HST, say you want to do general surgery that you think is interesting. Things that I find specifically interesting about this is that you have structured teaching, for example, or that you rotate through different units, etc. But I think the bones of your answer is very good. But do be aware, and it's a cautionary note to all candidates, is do be aware of the structure of training. And I think that's important to know if you're going for anything in the college.
All right, thank you.
Good, so well done.
Thank you.
The last question I will ask is to Umar, if you're there.
Yep. Hi.
How are things? So tell me, what makes you a good leader?
So I think leadership is very important in medicine and surgery as well. It's needed to guide the team. I think I'd be a good leader because I've had some experience in leadership roles. I've done teaching before outside of medicine, and I've done a HPAT preparation course. I was the senior most on our team or panel to do the teaching. Additionally, I'm actually not too sure of other examples. I need to think of that.
No, sorry, I think you started very well there with a definition. And then you feed it on to your own examples. Again, what I'm trying to get across in these situations is you're trying to get across your own experience in leadership. And as Ben alluded to, it's important to just think about this in the days leading up to the interviews. You have a specific example of being a leader, something that weakness, something, a difficult situation, so that you can fall back on these. And you'd be surprised how often they come up. But I think as you started doing, it's important just to have a structure and to lay on your own experiences. That was definitely a good start, but it's something worth thinking about, That's it. I'll stop putting everybody through the pain of answering questions on a Sunday morning. But I think generally the standard is excellent. It's just important to think on some of the pearls and some of the structures. And we put some of them up on the chat for you guys to think about in the lead up to the interview.
Just one more question, Kunal.
I hope and wish you all the best of luck in your interview.
Well done, Kunal. Sorry, Mustafa. Sorry, Adil. Just one question because we need to wrap. And from journal, there are some students, not student trainees, who are just finished their internship or finishing internship. They don't have too many exams or research, or you understand from the internship they are just trying to do a hard job first time. So if they are approaching interview, what's your advice, you, Ben, and other panelists? Any comment on that?
Yeah, so thanks. I think it's a very good question. And the first thing I'd want to say is I'd want to reassure those who are applying out of an intern year, and Ben alluded to this earlier, is that the standard that's of things or concrete achievements is titrated towards your level in terms of how far along in your career you are. So if you're coming straight out of intern year, obviously you've only had a few months to start research, etc. I think what is important is to still focus on some concrete examples of perhaps things you started, as Ben alluded to, things you've been involved in, courses you've signed up for, or looking to attend exams, you're looking to do a higher degree such as an MCH that you maybe have signed up to. So I think you can still spin this in a positive, and I don't necessarily think applying at an early stage will put you at a disadvantage at all. I applied quite early, and I felt it was, as long as you have some concrete examples of things you've thought about or started doing, I don't think you'd be at a disadvantage whatsoever. But I do think it's important, nevertheless, to still try and think of concrete examples of your experiences as an intern, or even as a first year SHO. What I wouldn't do is say, because I'm an intern, I haven't had a chance to do any research, because I think you should still be able to show that you've had some insight into experiencing that.
Thank you very much, Kunal. Very good talk. Thank you for putting people on the spot and giving them an idea of what it tastes like. I would just a question that has popped up when people have asked me. A lot of the people on this panel may be foreign graduates or have taken out a year and gone to Australia. Just to ask the panel themselves, should they be highlighting this, their experience in Pakistan or Australia, or should they be shying away and just speak about their Irish experience? That is a question that frequently comes up when people talk to me about this panel. So I just wanted to get the panelists' opinion on this as well. Dr. Khan?
I think, Adil, it's important not to hide anything. Be upfront. And as I always mention, as Ben and Kunal and other people mention, you need to identify your weaknesses. Every CV has some weaknesses, and the person know well, and should prepare the answer in advance and come up with a very positive kind of reason, but not wrong, or don't hide any fact, but mention what is the reason, why he or she went for that or had a little different experience, and what he gained from it, which is added up in his experience. So turn around the answer and say that experience helped him and is helping him is a wider experience. He has seen a different system. He knows what's in different system in the world, and he know when he go for fellowship, he can go, or he can go for some more experience, he can go back in those countries there.
No, I think it's actually should be considered positive, because unfortunately in Ireland there is a kind of a simmering bias against and we need to talk about this very frankly, the bias is against people who either trained in a different system coming into Ireland, and now there has been a simmering thing that, oh, well, after intern year, you went off to Australia or New Zealand for 2 years, now you want to come back. No, I think in a professional organization, in a professionally structured interview, the answer is yes, having worked in a diverse and a different system gave me greater insight into what that system does, and I can bring the strengths of that system into the system I'm going to work. And also, it's important to mention that at the end of the higher surgical training, we encourage trainees to go abroad to broaden their horizons. So why not encourage and accept the experience and training somebody did if they did internship in Ireland, went to Australia, New Zealand for 2 years, and now coming back. So I think it should be considered by the interview panel as a positive experience if somebody has worked in a different healthcare system. But it's important also to know a little bit about that. But I think it shouldn't really be held against it. So it's not a negative question. And it should be, again, if somebody goes off to Australia, absolutely, it could give them an exposure to another system.
Thank you very, very much for your insight and answers. I would like to thank the panel again. I know Dr. Wazi is left, but thank you very, very much for all of your time and helping out with this session. I hope it is very helpful for everyone. There are links to the previous sessions as well, and hopefully this will be recorded and put up as well. If there's any questions, obviously we'll take them. Otherwise, I'd like to give you back your Sunday, and for the participants, please practice. And I know Dr. Khan needs to go back to theatre. Thank you very much for your time.
Thanks everybody. Thanks Adil. Thanks all the panels.
Thank you.
Thanks very much.
Thanks.
Thank you so much. Thanks all of you.
Thank you.
Thank you.
Hi, Adil. Thanks for that. So
Thank you very much.
yeah, so I think we can close this meeting because I think most of the panelists have left. So we'll do the follow-up, later on.
Thank you very much.
Yeah, okay, that's good. Thanks.
Thank you very
Thanks, everyone.
much.
Bye, bye, bye.